Welcome to Future Talk. On today's program, we're going to talk about mobile apps and mental health. The smartphone has proven to be an incredible platform that enables us to do all kinds of things that we could never do before. And now it's extending its reach into the field of mental health. I have two guests. Julia Hoffman is a clinical psychologist and mobile apps lead at the Department of Veterans Affairs, where she develops apps to help veterans with post-traumatic stress disorder, as well as other mental and emotional difficulties. Maybe you could give a little bit of background on post-traumatic stress disorder. What is it, and what is the general approach for treating it?
Well, post-traumatic stress disorder, which is also called PTSD for short, is a pretty common disorder among individuals across the globe, Americans in general, and specifically America's veterans. And those are the folks that I work with. It occurs in about 7% of Americans and from about 10 to 20% of veterans who've been deployed. Basically, it's a normal reaction to a horrible situation of any kind. It can be combat, it can be a natural disaster, a traumatic experience like rape or assault. And it has a couple of key features where the person re-experiences that event. They think about it again and again in the form of nightmares or even while they're awake. They avoid thinking about it or talking about it as much as possible. They maybe feel numbed out. And then they also have some arousal symptoms. So they may startle easily, get angry, that kind of stuff.
So is it some kind of emotion that they try to repress, but they're not always able to repress it?
That's almost exactly it. I would say that the hallmark of PTSD is avoidance. So most of the most effective treatments for PTSD see PTSD as a disorder primarily of avoidance, where a person really wants to get away from this very unpleasant series of thoughts, and they want to put that event behind them. And in doing so, they work so hard to stay away from it that they never actually really process it. Most of the effective treatments, which luckily there are at least two that we provide in the Department of Veterans Affairs, are based on the concept of needing to work through that trauma and really experience it or expose yourself to it in order to get past it.
Do most people respond well to the treatment?
The people who get those treatments do respond well, yeah. They have excellent rates of success. So those are prolonged exposure therapy and cognitive processing therapy. Both are forms of cognitive behavioral therapy, and they happen in treatment with a trained behavioral provider, either one-on-one or in groups. And
can you get rid of it so it's gone for good, or is there always a danger that it's going to come back again?
No, you can get rid of it so that it's gone for good. I think that there has been some lore in the past that PTSD is a disorder that you're stuck with for life. And that comes from a previous era before we had the excellent science that we have now. And we're really actively engaging veterans in care that's specifically designed to move them through the trauma.